Hi, my name is Margaret Barnes. I'm doing the medication administration checkoff. Here's my badge, and I'm gonna scan the room now. Okay. First thing I'm gonna do is talk to you about a no interruption zone. So there's going to be 4 things you're going to do. You're going to follow your agency's no interruption zone policy. You're going to limit talking to colleague down to what's essential. You're going to keep the doors shut to the medication room, and you're going to keep the door shut and don't answer any phone calls. Okay. We're comparing the 7 rights from the order form to the MAR. So, heparin orders the medication ordered on the order form. Heparin on the MAR. Route subcutaneously on the order form, subcutaneously on the MAR. Patient Jones Jaguar J on the order form, Jones Jaguar J on the MAR. MR number 4176352 on the order form. MR number 4176352 on the MAR. Dose is 5,000 units on the order form, 5,000 units on the MAR. Time is every 12 hours on the order form, every 12 hours on the MAR. Documentation, don't have that yet. Indication is DVT prophylaxis. Oh, and allergies. She's allergic, or they're allergic to penicillin on the order form, and they're allergic to penicillin on the MAR. Now it's time to move the order form aside and just use the MAR, and I'm going to do hand hygiene. Okay. First thing we're going to do is medication. Heparin, 5,000 units subcutaneously every 12 hours. Heparin, 10,000 units per milliliter. Expiration 12/5/2025, so we can still use it. Okay. Route subcutaneously, so we're going to use a TB syringe. I'm going to take it out so you guys can see it. A 1 milliliter TB syringe. Set it back down. Patient is Jones Jaguar J. Dose is 5,000 units. Well, this vial says heparin is 10,000 units per milliliter. So we're going to use half a milliliter, and we're going to draw it up in just a second. Time every 12 hours. Indication is DVT prophylaxis, and documentation, don't have that yet. Okay, now it's time to draw it up. First thing we're going to do is clean the vial. Trash, okay. First thing I'm going to do is draw up half a milliliter of air. And insert it into the vial. And I already cleaned it. Perfect. Now I'm going to flip it up, and I'm going to draw half a milliliter of heparin. I'm going to go a little bit past it so I can get the bubbles out. Okay, now I'm going to pull the safety up and show it to you guys. Okay. So now we're going to do the 7 rights again. Medication, heparin in the vial, heparin on the MAR. And we just put heparin in the syringe. Route, subcutaneously, we're using a TB syringe. Patient, Jones Jaguar J. Dose, we need 5,000 units on the MAR, and there's 10,000 units per milliliter in the vial, so we drew up half a milliliter. And then we're going to do time every 12 hours, documentation, don't have that yet, indication DVT prophylaxis. Now it is time to make a label. Where's my tape? Here's my tape. Okay, so first thing we're going to put is the name, which is Jones Jaguar J. the drug, which is heparin, and the dose, which is 5,000 units. Now I'm going to put it on the syringe and show it to y'all. Okay, now we're going to go to the patient's room. We're taking the MAR, we're taking the syringe, and we're taking the vial. Okay, first thing we're going to do is hand hygiene. We're going to raise the patient's bed, lower their side rail, move them to a comfortable position. I'm injecting in their abdomen. Do some pre-assessment tests on them, such as like their lab values, their heart rate, respiratory rate, and also for this specifically, we'd be looking for bleeding. And now we're going to move on to the rights. So I have heparin on the MAR, heparin on my vial, and heparin on the label of my syringe. Route subcutaneously, I'm using a TB syringe. Dose 5,000 units, and on my MAR, and there's 10,000 units per milliliter in my vial, so I drew up 0.5 milliliter. And now we're going to do time, which is every 12 hours. Documentation, don't have that yet. Indication is DVT prophylaxis. Patient, we're going to look at Jones Jaguar J on the MAR, Jones Jaguar J on the armband, and I will bring it closer so you guys can see it. And then MR number on the MAR is 4176352. MR number on the band is 4176352. They're allergic to penicillin on the armband, and allergic to penicillin on the MAR. And I'm going to put this back up here. I asked the patient if they have any other allergies, and they say no. So now we're going to move on to the actual injection. But first, we're going to talk about documentation. Don't have that yet, and indication DVT prophylaxis. Okay, dose over 12 hours. Okay, so it's subcutaneous, and we're going to insert it at a 45 to 90 degree angle. 45 if you can pinch 1 inch of skin, 90 if you can pinch 2 inches of skin. Today we're going to insert it at a 90 degree angle, and we would pinch 2 inches of skin, but I obviously can't pinch 2 inches of skin on this thing. And we're going to put on our goggles first. Put on our goggles first. And then put on our gloves. And I guess that could be my one break in sterility where I touched my goggles before I put on I touched my glove before I put on my goggles. Okay. Now we're going to clean it with an alcohol prep. We're going to clean the abdomen with a alcohol prep pad. We're going to gently put pressure on it, not massage it, but gently put pressure on it. We're not aspirating either. So I got to insert it at a 90 degree angle, and it's heparin, so you go for 30 seconds or more, or over 30 seconds. Done. I'm going to put my safety on it and put it in the sharps container. Now I'm going to look and see if my patient had an allergic reaction, ask them about it, take off my gloves. They didn't. I'm going to lower the bed, raise the side rail. I'm going to do hand hygiene, document it, and then I'm going to come back in the room later on and see how my patient facilitated it. And that is the end of my checkoff.